Hello. Are you the night owl or early riser? I'm the night owl, but I intentionally decided to become an early morning person because there is scientific evidence it actually lowered down your risk on having depression for 27%. Worth trying. Let's go to the explanation. So there was one observational study from 2018. They compared actually 32,000 working nurses in medical institutions, and they find out that those who are getting earlier actually have much lower risk of becoming depressive in the following 4 years. So that observational study led to another study published in Psychiatry in 2021. The thing is that I understand both ways of functioning. How our societies are functioning is much more attuned to early risers, and people who are night owls usually feel out of sync, and I really know how that feels inside. For example, years ago when I was working in neuroimmunology lab, actually I had to get up early as 5 o'clock to catch a bus at 6 so I can be at my lab before 8. It was really strenuous, and in the end of that very stressful period I even become sick. But the problem is that you want to achieve much more than your daily schedule, especially if your 9 to 5 person allows you to do. The thing is that this study from 2021 is showing that just 1 hour shift in your sleeping schedule helps a lot and actually significantly decrease your chances to get depression. How that works? We are not nocturnal animals. Our society and culture makes us to accept those behaviors. But the thing is that you probably learned a lot about significance of enough sleep. So we already know that below 6 hours and even below 7 hours will probably accumulate that stress and drain your energy. So in the end, you're either becoming sick or you are burning out because you simply have to accumulate energy for your daily tasks and efforts. Very important role in this have circadian rhythms, meaning that probable explanation for this effect is that if you are seeing more sun, if you are actually stimulated to produce certain neurotransmitters, vitamin D, we are having our mood on the positive side. And this is something which is known for quite a long time, that early risers are usually more positive, they're less likely have rumination, things like that, and in general they're more resilient to having depression. The paper is actually addressing connection with genetic makeup, because some people are naturally drawn to enjoy early mornings and the others are preferring to stay long at night, so-called night owl, and I'm falling in that category. But genetic is not everything. You can do something. For example, you can try to schedule to go to bed earlier, let's say half an hour or 45 minutes before or 1 hour before, and in the morning you get up 1 hour earlier. Why it is important? Because if you get up and go to your computer straight, this is completely different situation than if you have an hour in the morning or even hour and a half to do some self-care practices like enjoying the morning, like I do every morning, meditating, doing your workout, or simply enjoying the sun. So I'm just going to share some pictures because this is my practice every day. I promised to myself that I'm going to actively engage in this task, and that really works on me. On some days I'm not to that schedule, but there is another study which shows that there is one single thing that you can do to improve your mental health, not only depression risks. And this is getting up at the same time, most likely early in the morning. So, for example, if you start your day with some pleasant activities, when you give the time to your body to wake up before you engage with some tasks, you are actually doing good to your wellness, to your overall health, and this is logical that it also translates to lower risks to become sick. In our recent works, when we study most important factors which are affecting different dynamics in bipolar depression, we figured out that in different subtypes of depression, the quality of sleep, the duration of sleep, the waking up time really play a significant role. For example, if a person is not sleeping well one night, I'm talking about healthy control, someone who doesn't have mental issues, that person is going to be most likely irritable next day. So you know the feeling. But someone who already had bipolar depression, one night without sleep can lead to episode. This is exactly what we showed in our previous papers when we were collecting the data on people who are already diagnosed with bipolar depression to see what the factors we measured are actually translating to good prediction of mania, because this is very important both for the patient and his or her family to be warned that this crisis is coming. Surprisingly, out of 173 variables that we collected on that particular research, only 2 actually showed to have prognostic value. 1 is the quality of sleep, and 2 is irritability. And irritability is number 1 predictor from the clinical variables from the classical clinical interview or self-report. Clinicians are actually collecting about their patients to figure out what is going on and how to help them better. If you know that there is one single thing to do to improve your mental health, and this is just getting 1 hour earlier, and this is significantly proven, why not do that? There is a single thing which depends only on your action. So think about that. See you next week. Thank you for listening.